What you see here is no ordinary massager. It's a facial release gun that can make you more mobile when used correctly. The FP007 has a lot of power to reach the deep muscles. Depending on the speed, the battery is sufficient for 1 or 2 hours of continuous operation and can be charged up very quickly. The battery has a high quality and lasts for several years. Of course, you can use it to massage your feet, your legs, or with a partner also your neck or back. For this, we strongly recommend that you always use the flat attachment. When we're already talking about massaging, don't forget the stomach area, because this is where stress is stored in the abdominal area. You will feel that as you slowly inhale and exhale, the stress will ease. But now we come to the main purpose of the FP007, namely for loosening facial adhesions. To do this, use the other attachments. I'll start with a little ball. In this video, I'd just like to explain the principle to you by using 2 examples. How to specifically treat knee, hip, back or other problems will be shown in separate videos. Or even better, attend one of our self-therapy courses. Due to the many walking and standing activities in everyday life, and because of sitting too often, we are shortened, especially in the front thigh area. This is also the reason why we bend over in old age and walk under pain. To be able to compare the effect before and after, we'll first do the following 2 control exercises. Sit on your heels. If you can't do this, just try as far as you can and feel where it's pulling or even hurting. We'll test your hip flexor and pull your heel to your bottom. Now you can see if the heel reaches the bottom or can even be pushed into your bottom. And what is the angle from the thigh to the hip? In order to remain pain-free for as long as possible, we have to loosen the facial adhesions on the anterior front line. This is especially the case here at the thighs and in the area of the hip flexor. We start here in the hip flexor area. Find painful points and stay there until the pain subsides. If you have found one and the pain has subsided, this means that the facial adhesion has dissolved. Next, we go to the thigh and do the same. Painful points are often in the lateral and anterior area. Find these points and stay exactly like before, again at these points. Often, you notice that there is a whole line, a line of painful dots. Then go from the beginning of this line, where the bone sets very slowly to the hip flexor. Try to stay until the pain is gone, and move to the top where the muscle attaches to the bone. I demonstrate it a little faster, but it usually takes you 3 to 4 minutes to go along that line. Do that on both thighs and hip flexors. Look for the painful spots and stay there until they disappear, which means until the facial adhesions dissolve at these points. You may find points that hurt very much. Then reduce the pressure, wait until the pain is gone. Increase the pressure again, and so on, until the pain has completely disappeared. This also means that the facial adhesions have dissolved. Now we control how it feels sitting on your heels. or how far you can bend down. So, there was a cracking noise. This is a consequence of the fact that tensions have been released and the knee is in the right line. You can also see on the side that I'm coming down further now, simply by the fact that these strands have dissolved here. We do the same now with the standing exercise. Here too you can see that I'm making progress, and that the angle is a little better here too. This means that the hip flexor has become slightly longer. The last control now is walking. How do you feel when walking? The best thing is of course to wear a kibun or a joya shoe and to walk very slowly back and forwards. Try to feel how walking feels like. Most customers tell us that there is a feeling of being much lighter and having a more upright posture. Now we do the same with the posterior facial line and control how far we can touch the ground with our fingertips. At the same time, please keep attention to where you feel a tension and where it might even hurt. The posterior facial line begins at the bottom of your feet, continues over the calf muscles, the hamstring muscles, and then also mainly over the muscles at the bottom and the back muscles. Accordingly, we now treat also the posterior facial line with the facial release gun FP007, exactly as we did it before. In my case, I prefer to use the cylinder now, because it allows me to penetrate a little deeper into the muscles. But of course, you can do the same with the exercise before, in case you notice that the little ball didn't give you enough results. Search for pain points all over the foot. Where there are pain points, there will also be facial adhesions. In my case, there is nothing to find now, so I search in the calf muscle area. Here I have found something, then I stay until the pain subsides at this point. Then I can finally press a little deeper or go along the line if there are any more points on this line. That's how I go along the calf muscles. And I'll do the same with the thigh muscles. Always searching for points here as well. It's always the same principle. You can also try to vary the speed. Take the speed at which you have the most effect. And again, look for the points. Very often points are in the pelvis area. And then, most of all here, in the gluteus muscle area. You work accordingly to the exact same principle at the thigh. The vast majority of pain points are in the area of the hamstring, towards the pelvic bone, and even more in the gluteus muscle area. Search here for the points, and when you have found adhesions, try going further up, even into the lower back area. If you have really found points, you will see that you have become significantly more mobile during the control exercise. Now we repeat the control exercise and check if we can get the fingertips any lower. In most cases you will notice, especially when you found something, that this treatment made you a lot more agile. Here we do the walking test again. The best thing is to wear a Keyboon or a Joya shoe and check how walking feels like. Yes, it really is the case that most customers confirm to us that walking feels a lot easier. The tensions you were feeling are caused above all by walking and standing on the hard and flat everyday floors, as well as sitting too frequently. We strongly advise you to try a Keyboon or Joya shoe today, so that the improved agility you've just achieved can be maintained. If you go back to normal shoes, you will notice that you keep losing mobility. Support your agility by applying a facial gun from Facial Performance daily, and keep this level of agility by wearing Keyboon and Joya shoes every day.